Hi, this is Dr. Tom Rogers of Performance Medicine with a very special guest today, a newfound friend, colleague, and confidant, Dr. Dave Beckner. It's so great to have you here today. I've gotten to know Dave really in the last few months, who's a guy that's we have a lot of common ground in that you're interested in preventive medicine. Now, Dr. Beckner is an interventional cardiologist, which means he goes into people's hearts every day and opens up blockages. And for some amazing reason, he's really interested in prevention of heart disease, which is kind of unusual. You know, he's been studying functional or integrated medicine like I have for, quite a while now. He spent a lot of time at the Cleveland Clinic, which is kind of the hotbed of integrative medicine. And we say integrative medicine, we mean prevention, really. I guess you would agree with that, and that we're trying to prevent heart disease. And if you notice, I have a cool-looking shirt on here today, which Dave gave me a few weeks ago. And Dave, great to have you here. Tell me a little bit about why you gave me this shirt and what it means. You have a farm?
Yes, thank you, Tom. It's been great getting to know you, and I really appreciate this opportunity. So we about 4 or 5 years ago decided that we really needed to leave our house. So we had, my wife and I had twins, and just felt like living on the lake wasn't the place for us. So we bought a farm. It's 100 acres. So we said, well, we have to have a name for that farm. So we're growing lavender and some other trees and things like that. And it's been a blast. I mean, a total blast, because it's a family kind of oriented time, that you can go out with all this stuff. And so we said, well, we have to have a name for it. And so my mom's middle name was Lou. And then the Sid comes from my German Shepherd, Sid, he was 12 when he died. He died a couple years ago. So Lou Sid, and we put it together, and we kind of like the ring of that. So
I love that. That's a great story. Doctors especially have to find a way to relax. I know my dad, who was a physician, loved being on his farm. He was operating all day. When he was off, he was on the farm, which really relaxed him a little bit. And that's so important for anybody to learn how to relax and to enjoy their lives. As physicians, we get caught up and work really hard, and sometimes physicians are the worst examples of health there is. So that's one aspect that I've tried to bring to my practice, is to be a good example for aging. So a lot of my practice is, of course, anti-aging. That's not a great term, but that's who I did my fellowship through for functional medicine. So we all want to live longer and healthier. It's that health span we're looking for, which is a period of time where you actually feel great. Lifespan really means nothing, because if you have to spend the last 10 years of your life wasting away in a nursing home, it's not good. So health span is what we focus on. And cardiovascular disease is by far the number one killer of any modern country. And so that's what we're trying to prevent. And you have some amazing things that you're doing here. When I walked into your office today, I was just blasted away about some of the stuff you're doing with actually the teaching of the cooking and the cardiac rehab. You're involved in, well, number one, your group that you're in here in the Tri-Cities in East Tennessee and Southwest Virginia is just an amazing cardiovascular group. I've always admired it and thought that if you had a cardiac event, you needed to be somewhere, this is the place to be. I mean, we're in a small area, yet we really have world-class cardiovascular services. I mean, you can't go to any larger city and find anything like what you guys have. I think there's no question about that. I mean, it's the gem of our whole healthcare system is cardiovascular with you guys, and we're so happy and proud of you guys. It's amazing. Dr. Jerry Blackwell, who's my next door neighbor and friend for many decades. I've always been so impressed with him and the things he's been able to do. He not only saved my mom's life, but I told you that story.
Yeah, that's
but he's just a great innovator, and you and Jerry have really been coordinating some things with the Pritikin Institute out of Cleveland Clinic, right?
Well, the Pritikin, so Pritikin has their longevity center down in Miami, and then they had a Pritikin center in California, but they closed it many years ago. So they've been working primarily out of Miami, but when they began to realize that there were so many people who needed this sort of care, they began to move out of this outpatient type program where it's more primary prevention. So in other words, people who haven't had a heart attack yet or a cardiac event, that's who they were initially treating down in Miami. And they decided we should give this to people who've had a heart attack. And that's what came out with the intensive cardiac rehab program that we were the 7th in the country to adopt. Now, all kinds of healthcare systems across the country are adopting this Pritikin intensive cardiac rehab because it is so effective in patients who have had a heart attack or even just surgery on a valve, heart failure. All those people qualify for the intensive cardiac rehab program. And the outcomes that we have, patients that go through this program are just remarkable. They're remarkable. And, our part of the country, unfortunately, is a hotbed for cardiovascular disease. It's one of the, I hate to say it, but one of the worst areas in the country for the development of cardiovascular disease.
Why is that?
I think that much of it is based on our lifestyle. We have the saying that, what we're learning now and that you and I have talked a lot about it's not so much your genetic code as it is your zip code. So in other words, we used to think that this genetics could not be changed. So when somebody would come walking into my office and they would say, well, my dad had a heart attack at the age of 55, I'm just waiting for mine. And, 10 years ago, I might have agreed with that person and said, well, let's do the best we can, but you're probably right. We believe nowadays that there's nothing further from the truth. These people can definitely change a lot of that with their lifestyle. Many of the things that you're able to do, with their lipid profile, looking into that and doing various things, understanding that diet and exercise is just everything. I mean, it's everything. Ultimately, everybody wants kind of the quick fix, and I'd love to be able to give that to people. Oftentimes it's more it's a marathon, not a sprint sort of thing. So you're trying to change someone's lifestyle, their lifestyle, and that's what Pritikin has been so effective at. You get these people in after a heart attack when they're motivated. And you begin to educate them. They exercise, and you saw the place we have for the cooking classes, and the patients go into those cooking classes and they begin to realize, wait a second, this stuff that I've been eating, I always thought, what patients say to me is, I always thought it was, bamboo and grass that you had to eat, to get your cholesterol level down. And we find out it really isn't. This stuff is pretty good, and they learn how to cook it on top of everything else. And before you know it, their lifestyle has changed. And the only problem I have with any of this, which really isn't a problem, it's just the fact that we can't get to these people before they've had their heart attack. Because a program like this, that we could reach a number of people in our area, we would save lots of lives, but in addition to that, we'd save a lot of morbidity, like you were talking about with the health span. That's everything now is health span. It's not lifespan.
Right, I agree with you. When you said that 10 years ago, you learned something that was completely opposite of what you think now. I found that to be true in a lot of medicine. Things that I've been out 35 years, and if you don't keep up and keep an open mind and study the stuff, then you're just going to be practicing from years ago, and it's completely wrong. Just like they told us about diet back in the 70s and 80s, it was completely wrong what they told us. As a result, we have an obese country, and that's one reason why we did so bad with COVID, is because obesity. So, my focus has been for years now at Performance Medicine has been to reduce obesity. And I study it continuously. I look at hormones. This stuff's complex. I mean, just with the panels that we're running now, like the Cleveland Heart Panel, where you can fractionate the lipid particles and look at that and kind of predict who's going to have heart disease and who isn't, is one that I think it's the best thing I do in my practice. I know that you can encourage people all you want, but unless you enact on it, that you're not going to get anywhere. It's just amazing that the resources we have to prevent heart disease, and in my opinion, everything mirrors heart disease. I mean, if you take care of your heart, you're taking care of your brain, i.e. prevention of dementia.
Absolutely.
You're taking care of course, prevention of diabetes.
Yes.
And also cancer. I mean, what we do prevents cancer. So, in the parameters we look at, like your Cleveland Heart Panel, your CT calcium scoring, Dr. Blackwell got me into doing those years ago, and I've run thousands of them, and really, I think probably saved a lot of lives based on getting that test and the Cleveland panel.
No doubt.
Because you can see inflammatory markers. You can see those fractionizations of your cholesterol. Even though you may have a fairly decent cholesterol number, if you're inflamed and you have a lot of small, low-density particles, or maybe ApoB, it's things that we look at that's a lot more detail, requires a lot more time. I told you a funny story the other day about one of my patients a few years ago that I'd run the Boston Heart Panel on. Now I'm doing more Cleveland's, but it's actually a funny story that bears repeating. But I had a patient that came to see me who had had a previous heart attack and had come to see me about something different. And of course, I ran the Boston Heart Panel on him at that time because it tells me so many other things like hormone levels, thyroid, adrenals, fatty acid breakdown, genetic markers for heart disease, and a lot of this. So I ran the panel and went over it with him, and it happened to be that he was going to follow up with his cardiologist the next week. And so, because he'd had a previous heart attack, and so I say to him, hey, you need to take this to your cardiologist. That way he won't have to run any more labs. He can just look at this, and you won't have to get any more lab work. This is great stuff. So he comes back about 2 months later for something else, and I go, hey, what'd your cardiologist say about your heart? And he goes, I'm never going to see that cardiologist again. And I go, why? And he goes, because that Boston Heart Panel that you said to give to him? He takes one look at it and says, this is BS, and throws it in the garbage can. And sure. I was just, number one, I was tickled by it. I thought it was kind of hilarious. And I was trying to figure out why he would do that. And we talked, and we both came to the conclusion that he didn't know how to interpret it.
Yeah, unfortunately, that like you said before, if you don't keep up with this stuff, this stuff is exploding. I mean, honestly, the stuff that I read and and have looked into, if you do not keep up with this, this will leave you in the dust. And you know, in cardiology, there are lots and lots of things to keep up with. You know, if you're an interventional cardiologist, you have to keep up with all the procedures that we do. Preventive cardiology, you have to keep up with the things we've talked about, and general cardio, on and on and on. So there's a lot of things that we have to keep up with. And I think as a profession, if I had one thing to say about our profession as a whole, and I'm extremely proud to be a part of this group in the Tri-Cities. I think our group is, I mean, I'll brag for a second, but I agree with you. I think it's one of the best in the country. We have, you know, just a gem here for our community. And it's the result of all the work that has been put into our group by our leaders, our present leaders, and our past leaders like Dr. Blackwell. And so, I mean, I think our group is I'm very proud to be part of this group. With all that said, if I had one thing to change about the cardiology profession as a whole, we don't spend enough time on nutrition, preventive medicine. You know, if the analogy that I give, it's like, you know, we have the faucet that's on, and all this water's running down, you know, onto the floor. And all the doctors have their mops out, and they're trying to mop it all up. And it would make a lot more sense to turn the faucet off. Yep. And you know, and that would be the preventive part of this. You know, if we were able to do that. You know, touching on another thing that you said that I wanted to follow up on also is, I heard a term the other day which fits right into this, and it's called inflammaging. And I
like it.
Yeah, and I did too, and it stuck with me because, you know, the obesity and the weight that we're talking about, and the lack of exercise, and even with COVID, what we learned is the obese people with metabolic syndrome and so forth that didn't do as well with COVID. It was a lot of this inflammation, and the obesity and metabolic syndrome creates all that inflammation. And what I try to tell people is how much better they would feel to get rid of that weight, which then has just a cascade of events that occur after that you and I know well. And you know, and I think patients, as they begin to get into an exercise program and so forth, they begin to realize, and that's very fulfilling for us to see.
I agree with you 100%. You know, when I see a patient, I think the biggest marker on how you're going to live your life and how healthy you're going to be is really your weight. I mean, it's pretty easy to look at somebody and it's just something that we don't address enough, because a lot of times it's like an elephant sitting in the room when you're with a patient, because it's kind of embarrassing maybe, or, you know, but I've been a doctor so long that I'm not embarrassed or shy about being pretty upfront with people, you know, and it's, as long as you do it tactfully, you know, you really help, and they do appreciate you bringing it up. And it's a lot more complex than, you know, just exercise more and eat less. You know, that doesn't work. It's so much more complex, because it's actually a metabolic lifelong disease, really, of insulin resistance. So, you know, we dig into it from that aspect a lot, as your insulin levels and all that, which correlate with inflammation. I like that new term. That's a great term. I have to put that on a T-shirt or something. That's awesome. All disease is a result of inflammation when you look at the root cause of it. But I agree. I couldn't be more proud to live in an area that has a group like your group, your Cardiovascular Associates, starting back from years ago when Dr. Harry Turner was starting you guys up, and through the years. It's just amazing to see what you've done. And when I walked in here today to your Bristol facility and saw the Predican model, and that you were one of the first ones to get on board, and you spent so much time with a lot of heavy hitters, I mean, throughout the country. I just hope that I can kind of be a part of this, you know, we can collaborate a little bit for our patients, and I can learn a lot more from you about this Pritikin protocol and how we can prevent. Mine, it's prevention. And what you're able to do, I'm just amazed at with the things you do with the catheters and saving lives. I mean, that's got to be so, gratifying to be able to have somebody come in with a heart attack with crushing chest pain. You open up that artery and they're immediately better. And that patient was probably going to die. What was that statistic you just told me before we started doing this? 80% of people, that's their first indication of heart disease is when they come in with a heart attack.
Yeah, that statistic is staggering, isn't it? I mean, but that's, the 80% of people. So what that tells me is that what you and I are seeing, what we've talked about with the metabolic syndrome, with the obesity and so forth, these patients are walking around out there and they have no idea that they're on the verge of a heart attack. You were talking about the coronary calcium score and some of the other screens we can do. We had the Health Expo here. We didn't have it last year because of the viral pandemic, but we gave away coronary calcium score screens to people, and just to try to identify those people that are at higher risk. We were so fortunate to have people, that are interested in this in our community, because including you, and I've learned a lot from you. We couldn't have done the Pritikin Center without Bill Gatton.
Amazing, man.
I know in our community, these people like you, like Bill Gatton, that want to try to help people in prevention so that they don't have to meet one of us in the cath lab. That's what I think is ultimately where you want to strive to be, is to try to keep these patients from having to go through those things. And, Bill Gatton was kind enough to understand that and to give us the funds for the Pritikin Center, not only in Bristol, but in Kingsport. So we have Pritikin Center in both places. And we have people like that in our community that are willing to do those things. So, it's just very fortunate to be in an area like this.
I agree 100%. And Dr. Beckner, your heart is in the right place. It's just amazing that we've gotten to be friends and gotten to know each other. We're on the same page. And ultimately, I think we have the same goals as doctors, is to, help people.
Yeah.
I mean, with our medical bureaucracy, and I know I'll rail about it a lot, most doctors really want to do the right thing, but sometimes bureaucracy gets in the way. But it's just so refreshing to walk in here today and see this amazing institute that you have here, and you're truly doing it for the right reasons. And I think it's just going to get better and better. It's really reassuring to know that you can live in an area like this where we do have an obesity epidemic and a smoking and a poor lifestyle, lack of exercise, and know that we have people like you who are going to save lives, and also people that are very interested in, improving our lifestyle and preventing bad things that are going to happen. Because as you age, a lot of bad stuff happens to you. Your arteries get a little hardened, and, we need to put our best effort to work together to prevent some of this stuff and to bring you a better lifestyle all the way around. I mean, think about, you're an exercise fanatic, I am too. Just your knees and your back, how much easier it is to weigh a lot less and to move. So, if we put all this stuff together, and I hope we can establish somewhat of a camaraderie on this to where we can help a lot more people, even on a wider basis, that we can bring to people maybe even all across the country, because a lot of people just don't realize this stuff. And I think it could be a great little collaboration that we have here.
I agree 100%. And the other thing that I'll add is, even, within many of the people in our community, my general feeling is that, we did a study for Pritikin, and where we took people with metabolic syndrome, and as we moved through that study and got these people more healthy, it became very apparent to me, as like one of those aha moments, that if you educate somebody, they will change. People say that people don't want to change. They want their lifestyle the way it is. It's too culturally ingrained. They've had this for generations, in Appalachia and so forth. And I've had some really smart people tell me that. And I don't believe it. Because in the study, and my experience has been, when these people begin to realize that, wait a second, so you mean to tell me that by carrying an extra 30 pounds that, like you said, my knees and my back are going to hurt? You mean there's this thing called inflammation? You mean that my diabetes is caused? Honestly, it is. A lot of people do not understand these things. And we have, people in our community that if they got that knowledge, and then in addition to that knowledge, they got the tools to help them reach their goals. My opinion is, and I believe this strongly, that people would change. People would change. They would become healthier, and everything in the healthcare system is about the mopping up the floors right now. But also, my opinion is that it would be cost effective for the healthcare system.
There's no doubt about that. I couldn't agree with you more. I mean, and I wouldn't want to live in anywhere else in the country than right here. I love where we live.
Me too.
The people we live with are so good and so kind, and I think people are starting to realize that from other places of the country. So we live in a great area. We have good people. We have smart people. They just need a little bit more education and emphasis on what they can do, because they truly can. I mean, you can change your genetics. I agree. Genetics are probably 10% of what's going to happen to you. You can even change your genetics by a lot of things, and mostly by what you start eating. That gut microbiome has a huge amount to do with your health of your heart, your brain, everything. So, this has been a wonderful talk. I hope we can do this more often, and when something new comes to the table, we'll sit and talk about it a little bit. We like to get our podcast out, and I think a lot of people do watch them. And I'm so proud and happy that you came here today, to join me, and it's just an honor to me to have you here. For somebody like you, that's I consider way up here as an interventional cardiologist, to even talk with me, and corroborate on some of this stuff that we've been doing for quite a while now. Like 16, 17 years ago when I formed Performance Medicine, a light bulb had gone off, and I realized I was really practicing medicine in the wrong way. I was just piling medicine after medicine on somebody. I had 7 minutes to spend with them, and I was just practicing the wrong way, really, because of the system. So I broke free from that, and I think I've become a better doctor. I certainly research things a lot more. I spend more time with my patients, and I'm able to, now maybe corroborate with people like you that can kind of say, hey, this is legitimate stuff that, we're doing.
Oh, yeah. And it's an honor for me to be here. I appreciate it. An honor for me to be here talking to you. So I appreciate that. And I hope we can, whatever good we can do for our community, ultimately as a doctor, that's what you and I both, I know we've talked about this before, and that's what you and I both got into this for.
Exactly right. As humans, our goal is to help other people. If we can't do that, why are we here anyway? But I appreciate this so much. I love my shirt. Thank you so much. I'm going to wear it proudly when I ride the creeper and I'm out there exercising. But thank you so much, Dr. David Beckner, and we will see you guys next week. Any questions, tune in to performancemedicine.net or get on our YouTube channels and our various platforms, and hopefully we can help educate you on how to live a healthier lifespan. Thanks, Dave.
Thank you.